associate professor of periodontics at Loma Linda, and I practiced half-time, a couple different places. I started in general dentistry. I was in the Navy for 2 years. I came back, took a residency. My major professor at the time was Jan Engelbert. He treated me a lot nicer than Alan did, although I started about the same time Alan did. So, and that was just brought home yesterday, very forcefully. I just had my 57th birthday. And that's rather eye-opening when you realize the next big one is 60. 30 was a major problem, 40 and 50 weren't, but 60 is going to be a major problem. Professionally, beyond practice and teaching, I've had the good fortune to spend a little time doing research. I've enjoyed that probably more than anything else. And the most fun part of research is who you do it with. And it's always been fun to have several other people involved in that. And that's about it.
Okay, let's pause there. How did that feel?
I do.
Okay.
And the most memorable moment in my recent past was a skiing incident too. I listened to Ron tell you about his. I was skiing with my 2 sons. I have a couple sons. One of them is 18, the other is 25. And we like to race each other down the mountain, which was a major mistake at my age, I've decided. And I beat him on this day because we have wax races, and the heaviest guy always wins in a wax race. So I was leading the way, and it was a beautiful day in Mammoth. You could see clear across the valley to the White Mountains that are over in Nevada. Everything was covered with snow. I'm cruising along about 200 miles an hour, looking at the scenery, not paying attention to anything, and I crossed my tips, or caught an edge, or something happened. I don't know what it was. But when everything quieted down and the snow leveled back, the big cloud that I threw up, I discovered that I had a 90-degree bend in my knee and a 90-degree bend at my boot top. And so I straightened everything out and taken off my ski and was just laying there, and this young ski patrolman came up and he said, "What'd you do?" I said, "I broke my leg." He said, "Well, let's see if you can stand on it." And I brandished my pole and I said, "Son, you touch my leg, you die." And so then he said, "Well, you're not acting like you have a broken leg." And I said, "Well, how are people with broken legs supposed to act?" He said, "Usually they scream and yell and cuss and swear and that kind of thing." And I said, "Well, I spent 2 years in the Marine Corps. I know the words, and if I thought they'd help, I'd naturally be saying them, but I don't think they're going to help me at this point." And he was insistent that I was probably pulling his leg and didn't know what I was talking about. So an older ski patrolman came up and he said, "What happened?" I said, "I broke my leg." He said, "Well, let's get you out here and get it fixed." Stuck me on a sled, took me down the mountain, and got it fixed. Just the difference in, how younger and older people treat mishaps, I guess.
Don't blame me because I went to those.
You'll notice I didn't even say that.
I could see what
Say
you're
where I got
thinking.
these from.
I could see what you're thinking. Right.
I'll take responsibility.
Okay. We're rolling, so begin whenever you are ready once you've got focus, and Ron will introduce you again.
Welcome, Dr. Volk. We're very happy to have you here with us today.
Thanks, Ron. It's nice to be here. For those of you who have never had periodontic failures, I guess you don't need to listen to us today. But for the rest of us, we're going to talk about some options and some adjunctive help to our armamentarium. If you have treated people periodontally and have had failures in furcations, circumferential lesions, have had patients who have refused to be retreated surgically or refused treatment surgically the first time, then what we'll discuss together today are going to be aimed at those of us who have those kinds of problems. And I want to emphasize that that includes me, because that has happened numerous times, all those scenarios. And The adjunctive therapy we're going to talk about today are going to make those kinds, give us another option for treating those kinds of situations that I've talked about, which is the purpose of our discussion today, to talk about how we're going to address those failures. The substance we're going to talk about is Atrodox, and it comes in 2 syringes. One syringe has a vehicle, and the other syringe has a powder that we mix together and that we can place in periodontal defects, packaged very attractively by block drugs. This is a cannula, this is the powder, and this is the vehicle. Thank you. And again, another slide that I guess we should have turned some of these out. The powder and the vehicle syringes can be joined together, and then we have to mix the powder and the vehicle by alternately plunging the plungers and the syringes back and forth, prescribed number of times. Then we put the cannula on the male syringe after we've expressed the mixture into the male syringe. The cannula is placed on the syringe. The cannula can be bent to make access to the pockets much easier. I'm not even looking at people, I'm looking at the slides. And this slide shows how you can place the cannula in a defect and express the material into the periodontal defect that you're going to treat. Okay. I'm not sure what's happening.
What this is, Gary, is it's
This is
injecting
mirror.
in the buckle, and you can
Okay.
follow where it's
Mirror,
actually
mirror,
expressed.
Gary.
Yeah,
How-
Yeah, it's a tough slide unless you know the orientation.
okay.
Taking a pallid view there.
Yeah.
Sometimes when you attempt to place the material in the periodontal pocket, it has a tendency when you pull the cannula out to stick to the end of the cannula, and the material then is pulled out of the pocket by the cannula. So you have to be aware of that. And one of the easy ways to keep that there is to use a wet Q-tip, put it over the end of the cannula when it's there, and then pull the cannula out. After you pull the cannula out, the material is left behind in the pocket. Use the wet Q-tip to help it set up. And when liquid hits the carrier, the vehicle, it becomes more firm and stays in place. And this is just a picture of that happening clinically. After the material sets up and becomes a little harder, you can place it, if it's left super gingival, you can take a dampened curette and force it into the gingiva, not with enough pressure to cause any harm or discomfort, but that'll help it. It's an easy way to get it to go subgingivally.
Let's pause right there. How did that feel? You very provide some service that way. If you need it, and you may not. Okay?
Oh, I do.
And remember, your own observation about not looking at us was the primary physical distraction. And as soon as you remembered, you approved it. Make sure you tell us.
And this is Dr. Cody.
Yeah, well, I forget.
And before you open your mouth to speak, make sure you find one of our faces and you start talking to one of us. And who's it going to be? Why don't you pick that person right now?
Larry.
Okay, so Larry gets addressed.
Today.
Or maybe Alan. For those of us who have never had any periodontal failures and have successes in all we attempt periodontally, maybe we can leave. But for, but for the rest of us, which includes me, whose life is full of failure, at least occasionally, then what we're going to discuss together today is something really new and different and very, very helpful, I think, as an adjunct to our armamentarium periodontally. We're going to, what were those three?
Well, what is this new adjunct you're talking about? Go ahead and
Yeah.
name it so that we're on the same page.
We're going to talk about Atrodox and how it's used, how it can be a helpful adjunct to our armamentarium, and possibly provide an alternative for the management of some of our failures.
What difference will this make for me?
Yeah. No, I haven't gotten to the outline yet.
Oh, okay. Oh, I'm sorry. I thought some of the things that you just went through were outlined.
One of the very helpful advantages to Atrodox is how easy it is to use. And what was the third? You got to have a list of slides. I'm
Right,
going to have to make
exactly.
myself nervous by trying to remember.
Helpful, ease of use,
Yeah.
and then you wrote down the word options, and I
Oh,
Good
I
treatment-
would
a
discover
good treatment
that.
option,
Yeah.
yeah.
so some of it you did.
Yeah.
Absolutely use.
So why don't you start? You just put up this slide. So name the adjunct you're talking about, which is Atrodox. Give us that outline, and then tell us how we benefit.
Now I'm so nervous I can't remember anything.
Okay. Is this yours here?
Yeah. Our purpose today is to talk together about a brand new product, Atrodox, which will hopefully help us, hopefully is a bad word,
See if you can recast it out in
Yeah.
a sentence.
which will help us treat some of those failures I discussed earlier more successfully and give us another alternative in our armamentarium. It's very easy to use and very user-friendly, very patient-friendly, and it causes neither the clinician nor the patient any great deal of pain, and has been shown by numerous studies on a large number of patients to be very, very helpful clinically. And when we're finished, hopefully you will understand how to use it, how it can be helpful and useful in all of our practices. It comes in a male and a female syringe. We have a liquid vehicle in one syringe and an antibacterial powder, doxycycline, in another syringe. Those two syringes are coupled together, and then the plungers are plunged alternatively for a prescribed number of times, and the two substances are mixed. After they're mixed, we end up with a mixture in the male syringe, and we apply a cannula that's provided with the kit. The cannula is bent in such a fashion as to make application to the defect that we're going to be treating easy. The material is expressed from the syringe into the periodontal defect that we're going to treat subgingivally. You have to be careful. The only minor little problem with Atrodox is that when you extract the syringe from the pocket, the material is occasionally sticks to the cannula and is removed from the pocket at that time. The easy way to make sure that it stays there is to dampen the Q-tip, press the cannula against the tooth but with the Q-tip, then pull the cannula out, hopefully keeping the material behind in the pocket.
Let's pause right there.
Okay.
Can you back up just to make the same point without the word hopefully leaving the material in the pocket.
Oh, right. We use a wet Q-tip pressed against the syringe. We extract the cannula from the pocket. The Q-tip keeps the material in the pocket. Then you can use the Q-tip again when it's wet to touch the material that you placed in the pocket. It helps it get firm and stay there.
We can pause right there,
Okay.
that's fine. Thank you. Let's actually